Welcome to part 2 of our interview with Angela Foran of Meridian Flow Acupuncture. In this series of interviews, we discuss Dr. Foran's experiences volunteering in Uganda with the PanAfrican Acupuncture Project. The project trains local healthcare workers in Africa to use simple and effective acupuncture techniques that enable them to treat the symptoms associated with HIV, AIDS, malaria, and TB. This segment of our interview deals with the application process, the costs often associated with volunteering, and Dr. Foran's advice on finding the right organization for you to volunteer with.
How was the application process? Was it a long process? Was it difficult to become part of the project?
For me, it was relatively easy. I think that has to do more with my experience. I know other people, it was a little bit more in depth. You have to fill out, like any kind of job application, hand in a resume and detail your experience and references and things like that. And usually there is an interview process as well.
And I suppose I would expect that's fairly typical for other NGOs or charitable organizations that other healthcare workers would have to go through a similar process. It was probably pretty standard.
I think so.
Okay.
The other organization that I volunteer at, it was a very similar process. I had to hand in a resume and have an interview, and I think it's a little bit more informal compared to applying for a job. I think it's more sort of getting a feel for the person and why they're wanting to do this, and
I expect there were some costs to you to volunteer, and often people have to provide their own airfare and for the cost of living and that sort of thing. Was that the same situation for this project?
So to be involved, because it is volunteer run and it relies on fundraising, mainly from the people that are taking part in the project, mainly the people that are doing the training.
Okay.
So we have to raise a certain amount of money to cover the costs of the training, like the supplies, the training manuals, and it also covers our transportation costs in the country and food as well.
And airfare.
Airfare is extra.
Okay.
If you can't raise money for that if you want,
or it can come just out of pocket.
Yeah, or it can come out of pocket. So I think it depends on people's fundraising abilities more than anything. So,
is there any advice or anything that you could leave our viewers with that might, if they were going to be interested in doing some sort of volunteer work abroad, is there any sort of advice that you could give them about either your experience or finding the right group to work with or anything like that?
Well, I think just look around and see what kinds of opportunities there are. I chose this particular organization because I liked the idea of that training people, rather than just going in and treating people and then leaving and then having no idea what's happening.
Right.
So it's a continuous thing, it's something that is building especially in Uganda. There's, lots of people that have now had the training and they are continuing to provide this treatment to people. So I think, if you're looking for an organization, there's lots of them out there, but finding something I think that resonates with you, and then just having an open mind, basically, because you don't really know what to expect until you're there, you know, and so, and even if maybe your first experience isn't that great, there could maybe
be another organization
or a different
better
place
for you.
or whatever. I think it's definitely worthwhile to explore other options.
Great. Well, thank you so much for sharing your experiences.
If you would like to learn more about the types of services Angela provides to her patients, or to have a look at more pictures from her experience in Uganda, please visit meridianflow.ca. If you are interested in healthcare-related volunteer opportunities, check out the Resources Center at peoplemenders.com for more information and to find links to organizations you may be interested in working with.